What difficulties, what challenges do caregivers and people who are taking care of themselves face every day? I'm Pamela D. Wilson, a caregiving expert, and I'm here to answer this caregiving question. My website is PamelaDWilson.com. Please share this video and my website with other people that you know who are looking for hope, help, support in caregiving situations. So one of the problems with caregiving, whether we are caring for someone else or we're our own caregiver, is that there is no roadmap. There is no connect the dots. There is no 1, 2, 3, 4, 5 step process for knowing what to do and how to care for ourselves. The earlier that we take an interest and the more education and help that we seek, the better off we will be in the long term. Part of what we learn through caregiving and trial and error, and it's kind of like being just thrown into the fire to survive sometimes, is that we learn problem-solving skills and we learn critical thinking skills if we look at the decisions we have to make and we gather information and look at the pros and look at the cons. In any area of our life, if we keep doing the same thing over and over again and keep making the same mistakes over and over again, it probably means that we're not learning. And maybe we don't have good problem-solving skills. Maybe we don't have good critical thinking skills. Maybe our judgment isn't where it should be. And this is where talking to other people in similar situations who have experience can be valuable. Whether that is joining a caregiver support group or taking an online caregiver course like I have on my website, or scheduling a one-to-one elder care consultation with me. Sometimes we just need to bounce ideas and bounce information off another person who has more experience doing that than we do, so that we can avoid all of these difficulties and challenges, or at least feel like they are more manageable. Caregivers constantly are responding to unexpected situations. You get that call from mom or dad that says, "Oh my gosh, we've fallen, we need help." Maybe you're at work and you get 10 phone calls a day about all kinds of little things like, well, the remote control doesn't work and the dog got away, and it's all of these emergencies that your parents have lost the skills or the ability to manage for themselves. And so you as that caregiver are having to step in to be that person, and that's complicating your life. Also, I'd like to talk about the medical system and the healthcare system. Doctors, specialists, hospitalists, healthcare providers have a lot of value and have a lot of information to offer. But the disconnect is sometimes because they haven't had that experience themselves. They're advising you because of either book smarts or something that they've seen with someone else but yet haven't experienced. And so the information they give you that you trust, you may try it and it may not work out the way that you expect. And I'll give an example. So a nutritionist who believes in everything natural tells you, oh, don't eat any of that, what I call fake butter, right? Margarine. They say, eat the real thing, eat butter. Well, have you ever looked at the nutritional panel of real butter and margarine, or what I call fake butter? If you have high cholesterol, do you know which one you should be eating and which one you shouldn't be eating? Even though this nutritionist, who knows nothing about your blood panel numbers, is giving you advice. And I'm not going to give you the answer to that until the end. Same thing about a nurse practitioner who works for a doctor's office. Let's say you go in for a cold or a sinus infection. She's like, oh, you just have a regular cold, you don't need anything. But yet your cold or your sinus infection keeps getting worse and you're blowing your nose and you've got green stuff and yellow stuff coming out. And she's like, oh, that doesn't matter anymore. That's old information. But yet you go to an ear, nose, and throat specialist who says, oh my gosh, you have this kind of stuff coming out of your nose. You need antibiotics. There are generalists and there are specialists, and the difference between the two are significantly different. So when you're having challenges in caregiving situations, you have to make sure that the person that you go to for that information asks you the right questions so they have the context of your situation, and gives you good advice. You've got to become your own investigator, your own advocate for your health, the health of your loved ones, if you want to have good results. You want to avoid being naive in how you search for information and where you search for information. The internet is a wonderful place, and the internet is a dangerous place because your situation is different from everyone else out there. There are similarities, but the similarities may not be what you think. So let me go back to answer that question about butter or margarine or fake butter. If you have high cholesterol, go look at the food labels on the fake butter. Many times you'll see that it has 0 cholesterol in it, where if you look at the food label on butter, there is cholesterol in butter. So if you're trying to manage your cholesterol, sometimes things that a nutritionist tells you don't work out the way you think. You're going to go get your blood drawn and your cholesterol is going to be sky high, and you're going to think, well, that nutritionist should have known what they were talking about, but they didn't, because they didn't know the true context of your situation, and they didn't know what to ask you. I'm Pamela D. Wilson. Thanks for being here with me for this video about what difficulties and challenges do caregivers face. I know there are so many because of my experience navigating this world for my clients for over 20 years. Please check out my website, PamelaDWilson.com, and all of the information there, and share these videos with everyone you know looking for hope, help, practical support, and realistic information. Have a fabulous day today. I'll see you all again soon in another video.